thank you for joining Minding Your Brain. My name is Candace Gantt. I am the Executive Director and founder of the Mind Your Brain Foundation. Today, we are going to talk about making your holidays happy for brain injury survivors and their caregivers. My guest today is Dr. Janet Belitsky. Dr. Belitsky's graduated from Immaculata University with a doctorate in clinical psychology and has been practicing for 19 years at Bryn Mawr Rehabilitation Hospital in Melbourne. She has a specialty in clinical neuropsychology and medical disabilities. She was also an adjunct professor at Immaculata University from 2005 to 2014, where she taught ethics and group processes to master's and doctoral level students. Currently, Dr. Belitsky is a facilitator of a monthly brain injury and concussion group at Bryn Mawr Rehab. Dr. Janet, as she prefers to be called, joins me today with a wealth of knowledge and insight, professional experience on daily and persistent challenges of survivors of brain injuries and concussions. Today, we are going to give you some tips on how to make your holidays and keep them happy holidays. I would like to, again, welcome you. Thank you so much for joining us.
Oh, I'm so glad to be here today, Candace.
It's a really important topic around the holidays, and so I really want to talk about not only brain injuries, but also about some tips that we may be able to offer to brain injury survivors so that they can thrive over the holidays.
Sure.
So my first question is, there's a lot of verbiage around brain injury terminology. Is it an acquired brain injury, a traumatic brain injury, mild brain injury? So can you unpack that for us and give us a little more information about what these brain injuries really mean?
Absolutely. And it does get confusing, Candace, in terms of all the nomenclature. I'm going to try to sum it up as simply as I can. A traumatic brain injury is an acquired injury. That means there's been a sudden trauma to the brain. And this sudden trauma can be caused by some kind of outside force that impacts the head, that strikes the head, and can cause some damage in the brain or also in the skull. Now, the degree in which this impact has depends on several different factors. So we have nomenclature that describes brain injury as a mild injury in which there's less than 30 minutes loss of consciousness, if there's even any loss of consciousness. So that's also called a concussion. So mild traumatic brain injury is synonymous with concussion, and typically if there is loss of consciousness, it's less than 30 minutes. But not everybody loses consciousness with a mild traumatic brain injury. I want to emphasize to those who are viewing today that there's nothing mild about a concussion. And we'll talk more about that as we move on. There's moderate traumatic brain injury as well. Again, that differentiation is more than 30 minutes of loss of consciousness, and the impact to the brain, depending on the strength of the force, also determines the severity of the injury. Same with severe traumatic brain injury. There are different types of actual impacts to the brain. So what we have found that there's a direct impact. There could be a direct impact to, let's say, the frontal lobe, which is the front of your brain. And that could be someone was hit, somebody hit their head in a car accident, somebody had a sports injury where the ball hit them in the head. And what can happen there is that the brain inside the skull is like Jell-O, and it will jiggle forward and backward. If the immediate hit is right to the frontal lobe, the brain will jiggle and it will sort of concuss backwards. It could damage the back of the brain as well, and also the front of the brain. So also if you're hit on the side, same thing can happen, and oftentimes we see what we call brain bruising. And that can happen with mild, moderate, or severe traumatic brain injury. Also, the direction in which the brain is hit. If you were driving an automobile and your head is angled in some way or rotated while you've had the impact of the car accident, there could be what we call diffuse axonal injury, which is when brain cells stretch because of the impact of the brain being hit on an angle, and with that stretching causes cell damage. So we see that part of the traumatic brain injury as well, but then there's also whiplash injuries where you don't actually have an impact to the brain. It's still traumatic, and that could lead to, serious kinds of deficits, which we can talk about in a minute.
They all sound traumatic to me.
They are.
Anytime you hit your head.
Absolutely.
And it has, I'm sure, impacts in so many different ways. So can you describe to us, tell us, there's several different types. What are the symptoms of each of those types, or are they all similar and they have the same deficits?
So, great question. When we look at traumatic brain injury, we're looking at it as a whole. And typically, whether you have a mild injury, which is a concussion, moderate or severe, they really share similar deficits. And we break them down into three different categories. The first category are the physical deficits that many injured patients experience. And some of the top ones that we see are headache, confusion, disorientation, dizziness, loss of balance, changes in their vision, blurred vision, double vision, eye strain. There's many physical symptoms where they have difficulty in terms of concentration and memory, sustaining, conversations, that type of thing. So it's the physical aspect of it is really similar with all of the types, mild, moderate, and severe.
All similar.
Yeah.
And can you tell us then how long these issues, how long these deficits or these challenges, how long do they last?
It depends. It depends on the injury. It depends on the severity. We really can't give a time frame in terms of how long the symptoms will last. Typically they give us a time frame for concussions where a concussion can last, up to 3 months, maybe possibly 6 months. Again, it just depends on the actual injury itself. We typically do see a lot of improvement with our concussion patients. Moderate and severe, again, it depends how long they lost consciousness, if they did, if they had any kind of post-traumatic amnesia, if they were in a coma. All of this really determines prognosis. So again, moderate and severe, we just don't really have a timeline in terms of healing. Yeah.
And with that, do they all have the same, no matter how the injury would have occurred, do they have the same injuries? Does everybody have the same deficits, or are they all different depending on what part of the brain?
Yes, part of the brain depends. If it's a frontal injury, we're going to see a lot more maybe personality changes. We're going to see some executive functioning, which is part of our daily organizing our life, planning and executing tasks. We can see some disinhibition, where people will they don't have as much of a filter, and so they
It must be interesting to help that population.
Yeah,
Challenging.
definitely challenging, but definitely something that we can help provide cues and education to both the patient and their caregivers in terms of helping them with that.
Well, that's terrific. And so to follow up with that, how is it that we can help them over the holidays? Now we know that they have perhaps some significant deficits and challenges over the holiday with overstimulation and executive function. So how can we help them if we see them at a family gathering or a holiday party?
Yes.
Is there something we can do to make them comfortable?
Yes, a lot can be done to make our patients comfortable. And I just want to just add here that much of what I've learned in terms of this piece is from my patients. In particular, my patients in my support groups. So a lot of what I'm sharing is being offered by other individuals who've experienced brain injury. So first and foremost, I think it's important that if someone with a brain injury is attending, let's say, a work party, that they would connect with another colleague who will be sort of their buddy for the party, and sort of just take care of them, just take them under their wing and keep an eye on them, and they will be able to see whether or not the individual is needing some extra assistance, or if they're starting to fade, if they need to help that individual move to another part, a quieter part of the party, where they can decompress, they can retreat, and try to sort of regain some, self-awareness and energy to be able to sustain the rest of the party, or if they may have to leave early. So I think it's really important that with, work parties, even going to church or going to synagogue, if there's gatherings around the holidays, again, have a fellow congregant, have a family member accompany the person so that they have someone they can go to if they're not feeling well. It's really important that an individual feels that they have that kind of support, because it can be absolutely overwhelming.
Indeed. I think that when we talked about noise assault and those physical disabilities, those physical challenges they have, that they would be very present at a holiday party in public.
Very much so.
So that we need a safety net.
Safety net, right. And it's just really important, too, for those who are hosting the party to understand that there's going to be a sensory-friendly kind of area that they need to establish for that person. Oftentimes with brain injury, one becomes hypersensitive to lights, to sound, and although they may come prepared by wearing noise-reducing headphones or earbuds, they still may need a place where they can that's off to the fringe. It's like off to the side, and they can just sort of decompress and then get back into more of the party. So I think it's important that the host accommodates individuals in that respect. Right.
And that leads me to the next question, which is a great segue to that. What is it that the brain injury survivor can do in advance, knowing that they have these opportunities to be in the community and go out and celebrate the holidays? How do they prepare for that?
They have to do a lot of preparation.
Yes.
It's a lot, and but it can work. So, well, first and foremost, it's important that the individual paces themselves during the holiday season. Pacing is very challenging for many people, because they have set their goals maybe too high in terms of what they want to accomplish with shopping, with preparing food for people, getting together at parties and so forth. So we ask them to really just prioritize what's the most important, and one thing a day. So if they have to go out and they have to do some shopping, we recommend that they bring somebody with them, that they don't drive, that they have the other person drive, that they don't listen to the radio on the way to the store or to the mall, and that they really try to conserve their cognitive and physical energy in order to be able to, complete that task of what they're doing. It's really, really important that they conserve that energy, because there's not a lot in the tank. And so they always have to refuel after these kinds of outings.
Interesting. So is that part of the techniques that they learn, how to manage their time better and to have...
Yes.
And for them to understand, what's my best time to go out to a holiday party? Is it on the weekend, or is there a timing associated that they have to navigate?
Absolutely. And we, let's say if you're going shopping, we recommend go to the stores when they're less crowded. I know this season it's crowded anyway, but we say, early in the morning, if you can do that, later in the evening, if you're up to it, if you have enough fuel left to do that, but always bring somebody with you, and just really do one errand a day, as opposed to cram like 5 errands in for one day, because that's going to be absolutely exhausting. Yeah.
Oh my goodness.
Yeah.
And what kind of words can they use to tell somebody that they're overwhelmed or they need help? Is there something that they can, how do they communicate that they're fading, or that they need a quiet space? Right.
Well, just being very honest and very direct, and saying, right now I'm sort of losing train of thought here, or I'm not following the conversation. If you don't mind, I just need to remove myself right now, and I need just to decompress a little bit, but I will be back, and I'll be back into the festivities, just communicating directly to whomever they're speaking with that they need to take some space, that they need to retreat in order to refuel.
That's important. And then I'd like to ask you about their caregivers too, because I know that it's a challenging time for caregivers. They may be already exhausted from taking care of a loved one.
Yeah.
How do they manage the holidays?
It's a lot of management. I think what's really important for the caregivers is that, again, they prioritize what the tasks are or what they want to accomplish. They set out their goals and prioritize those goals ahead of time. So they're not going to be able to maybe do all of the things that they used to do in previous years around the holidays, having a lot of parties, having a lot of people over, entertaining. They may need to streamline that. They may need to, make sure that if they are going to be attending parties with somebody who has a brain injury, that again, they may have to say no. They may have to say, we have to cut this short, or we can't really stay very long, but, just, feel like, okay, I'm making a connection here, but we're going to have to go. So prioritizing is really, really important. And being able to say no to invitations and to offers is also really important. Again, speaking to the person, your loved one who has brain injury, and sort of deciding that together, I think is really meaningful.
Yes, because they may be sensitive to, you don't want me to go to the party if you're telling me we shouldn't go.
Exactly.
And maybe being sensitive to that
Yes.
response from a caregiver.
Absolutely, absolutely. And really, it's so important for the caregiver to take care of themselves. Self-care is critical for them, making sure that they're continuing with their routine. Hopefully their self-care routine includes, eating the healthy diet, exercising, getting out of the house, getting out, breathing the fresh air, journaling, doing some yoga, doing some meditation, something that's going to offer them just for their own decompression.
To take care of themselves over the holidays to get through it.
So they can take care of their loved one. Right.
It's very, very challenging times I know that we're coming up to. Can we also talk a little bit, I know that you're a facilitator of a support group.
Right.
And can you tell us what type of, because not everyone is familiar with how to get help or where to go, what does a support group provide to this community?
Oh, support groups. Well, it really provides a sense of universality, and that's a term that we use in group process, which really basically means we're all in the same boat together. People can relate to one another in terms of the symptoms that they're experiencing, but more importantly, in terms of how they're coping. And so a support group really offers ways to help individuals adapt to their new lifestyle. Because after brain injury, they may not be exactly what they used to be. I always say maybe they could be new and improved.
Oh,
right?
that's great. Yes, yes.
So it's really an opportunity for people to come together to share their stories, share their coping strategies, or if they get stuck, this is my situation. Does anybody have any suggestions or ideas? And I think that's a really critical part of a support group. I know it's important for them to be able to vent and to be able to talk about, what's been going on for them. I think that has a place in the support group. But even more than that, I think it's important that they learn strategies in terms of how to cope and to accept their challenges.
Who they are.
And to try to live a quality life again.
Absolutely. And I know that a lot of people, and myself included, when I was considering, after rehabilitation, considering that option for community,
Right.
that I wasn't too kumbaya-ish. I didn't know if I wanted to share everything. I'm kind of private and sensitive to that.
Sure.
Can I still be, do you
Absolutely.
have those people in your community?
Absolutely, absolutely. So in my support group, this support group, I think I started it about 9 or 10 years ago. And I started it because there was a demand after patients discontinued their outpatient program at Bryn Mawr Rehab. They felt lost. They felt like there was nobody to go to anymore. They just lost, people who they became friends with in the program, and then they just were left on their own. So I thought, they need a community.
Yes.
So I started this support group, and it's just grown ever since. And yes, there are people there that like to share. There are other people that love to listen. I know that they're actively listening because I can tell by their nonverbals. And they might pull me aside at some point and say, oh, this was such a great topic, or it was so helpful for me to be here today. And it really just gives them that sense of, like I said, universality. Like,
Yes.
I'm not the only person living with this. Right.
And are caregivers welcome to come to those groups as well? And do they come together, or do you have two separate meetings with them?
So with my particular group, caregivers are more than welcome to come. In fact, I think it's really crucial that they come, at least in the beginning, so they can get the education, but also see that their loved one's not the only one dealing with this. It's amazing the awareness that they gain by hearing other people tell very similar stories in terms of what they're experiencing. So I think that's very powerful for the caregiver, and it really helps them adopt maybe a different perspective than they may have had originally. So in my group, yes to the caregivers. They can come anytime they want. I don't have actually a separate group for the caregivers. However, my colleague, Dr. Cynthia Simons, runs a brain injury support group once a month. And she has one group just for the brain injury individuals, and then she has another group that's facilitated by one of our nurses at the rehab for the caregivers, which is quite lovely. So I will refer my other group, caregivers, to that group.
Depending on what their needs are and how they
Exactly.
how they're navigating through their recovery.
Exactly.
Yes, and so are a lot of your caregivers and your survivors, are they long-term in your group, and they build this community, and do they do activities together?
They do. It is a long-term group now, because I think we're 8-9 years going here. They've been amazing. They have taught me so much about advocacy. I wasn't really involved with the Brain Injury Association of Pennsylvania, and now I feel like I'm quite an advocate. I helped them write a letter to the legislators for this past Tuesday's Brain Injury Awareness Rally, and I feel like this is the momentum. We have to work with this. They've taught me so much. This group has taught me so much, and they just keep expanding their involvement in the community. Mind Your Brain. We have a bus that goes to Mind Your Brain conference in March, which you do a lovely job facilitating.
Thank you.
So we've just done a lot of things that are outside of the group itself.
So it keeps them in the community and active and being able to make good choices about activities they're doing.
Right.
That's terrific.
It is.
I am so excited for Bryn Mawr Rehabilitation to offer these services, because I'm sure there's people watching this program that are just challenged and they don't know where to go and what to do and what's my next step, and nobody believes me. Perhaps there's certain times that they don't really, their family, friends don't recognize the challenges they're having.
Right.
And so I know that during the holidays, it's an important time to really protect and embrace this community.
Oh,
Get them through
absolutely.
the holidays.
Absolutely. And also just protect the caregiver as well. I just think it's so important. Our caregivers are absolutely amazing. And
I just have a heart for all that community, and I see you do too.
yes.
Dr. Janet, is there a way that they can get in touch with your group at the Bryn Mawr Rehabilitation Center?
Absolutely. So what you can do is you can call our group, Bryn Mawr Rehab Hospital, and our number there is 484-596-5430. And you can just let whoever's answering the phone know that you saw me with Candace Gantt, and that you're interested in the support group or interested in any other kind of services that you may need.
Thank you so much.
Yeah.
Thank you, Dr. Janet.
Oh, it's a pleasure to be here.
It's a pleasure to talk with you. Thank you for joining us today. And if you'd like more information about Mind Your Brain Foundation, please, at the bottom, you'll see our website. It's mindyourbrainfoundation.org. Please come and visit us. We will have a wealth of information and resources for you as well. And I think we both want to tell our community of brain injury survivors and caregivers that we really care about you and that we're wishing you the happiest of holidays.
Absolutely.
Thank you.
Thank you. A couple parts.